Why is the urea breath test used for H. pylori diagnosis? Imagine a simple test that can tell if you have a stomach infection caused by a tiny bacteria called Helicobacter pylori. This bacteria is linked to stomach problems like ulcers and gastritis. Now, how do doctors find out if you have it? One of the most effective ways is through a breath test called the urea breath test. This test works because H. pylori produces a special enzyme called urease. Urease breaks down urea, which is a natural compound in your body, into ammonia and carbon dioxide. During the test, you swallow a small amount of urea that has a special form of carbon called a carbon isotope. If H. pylori is in your stomach, its urease enzyme will convert this urea into carbon dioxide with the isotope. This labeled carbon dioxide then enters your bloodstream and is exhaled in your breath. The test measures the amount of this labeled carbon dioxide in your breath sample. If there is a lot of it, it means H. pylori is present and active in your stomach. This makes the urea breath test a direct way to detect an active infection. The reason it is preferred over other tests is because it shows current infection, not just past exposure. Blood tests can show if you have ever been exposed to H. pylori, but they cannot tell if the bacteria are still there. The urea breath test is also less invasive than procedures like endoscopy or biopsy, which requiring inserting a tube into your stomach. It is safe, quick, and suitable for both adults and children who can follow simple instructions. Doctors often recommend this test to confirm if H. pylori has been successfully eradicated after treatment. It is also useful for initial diagnosis, especially if you have symptoms like stomach pain, nausea, or indigestion. Early detection helps doctors prescribe the right antibiotics and medications to clear the infection, which can help improve your gut health. Before taking the test, you should avoid antibiotics, bismuth compounds, and proton pump inhibitors for a few weeks. These medicines can lower urease activity and give false negative results. After treatment, the urea breath test can confirm if the infection is gone, helping you and your doctor know when your gut is back to normal. In summary, the urea breath test is a simple, accurate, and non-invasive way to find out if H. pylori is causing trouble in your stomach. It helps guide treatment and supports your journey to better digestive health.